Hi, welcome to Pharmacy Lecture. In Part 1, we started hospital organizational structures. In this topic we covered classifications of healthcare, classifications of service, regulatory agencies, administrative challenges, and impact of technology. In Part 2, we will learn about administrative challenges, the hospital as a delivery system, hospital management model, functions of the hospital administrator, and functions of the medical staff. So, without wasting any time, let's begin today's lesson.
Welcome back. Today we will learn about administrative challenges, the hospital as a delivery system, hospital management model, functions of the hospital administrator, and functions of the medical staff. If you have not watched Part 1, then please watch Part 1 to complete your lesson and to understand properly. So, without wasting any time, let's start today's lecture. Administrative challenges. Professionals typically cherish their right to self-regulation. In this, we can see the challenges of administrator. Number 1. Group conflict is unavoidable. Number 2. Internal communications are impeded. Number 3. Consensus is more apt to be absent. Now, we can divide administrative challenges in two main parts, that is, internal and external. Under internal challenges, administrative have to handle medical staff, competition between health professions, unions, physical resources, size and complexity of organization. Under external challenges, administrative have to handle government, funding, regulatory agencies, public demand. Hospital administrators require interpersonal skills, effective communication skills, and leadership skills. Now we will see how hospital act as a regulatory system. Hospital is primarily a non-profit system. Hospital is a third-party government-financed system. Demand for services can bear no direct relationship to societal needs or the available supply of necessary resources. The rate of hospital admissions has increased, but the average length of stay has decreased. The healthcare system is presently undergoing rapid, radical change. Next, in this slide, you can see hospital organization in a diagram, which is governing board regulating medical hospital staff and administrator, both. Now, we will see what is hospital management model. Governing board. This body appointed by government only, chief executive officer, who is nothing but hospital administrator and medical staff organization. What is functions of the governing board? To provide adequate financing by securing sufficient income and by enforcing business, like control of expenditures. To provide for the safe administration of funds given in trust, example, gifts and contributions. To maintain accurate records of its finances and activities. Now, we will see what is function of the hospital administrator. The hospital administrator function is identical to that of the president of any corporation. Individual styles are judged to be successful if the determined results further the organization toward its goals. Remember that being a hospital administrator places more of a strain on character than on intellect. Functions of the hospital administrator. Submitting for board approval a plan of organization and recommending changes when necessary. Preparing a plan for accomplishing the institutional objectives as approved by the board and periodically reviewing and evaluating it. Selecting, employing, controlling, and discharging employees. And last one is submitting for board approval an annual budget. There are more like safeguarding the operating funds of the enterprise, maintaining all physical properties, which is plant and equipment, in safe operating condition, representing the hospital in its relationships with the community and other health agencies. Serving as liaison between the board, or its committees and the medical staff. There are more important functions of the hospital administrator, like assisting the organizational medical staff with its and administrative responsibilities, submitting to the board annual reports, which describe the nature and volume of the services delivered during the past year, and advising the governing board on matters of policy formulation. Next is the medical staff. Remember, doctors represent the initiators of every action that results in the direct provision of patient care services. Doctors determine who will be admitted, when will be admitted, and where will be admitted, what medical services are to be provided, in what sequence, in what dosage, with what equipment and supplies when, where and by whom, who is discharged and when. Remember, the doctor is not an employee of the hospital, he or she is outside of the hospital organization. And doctors control, yet are not accountable, for nearly 90% of hospital expenditures. Medical staff. Participation by the medical staff in the decision-making process is in the best interest of both the hospital and the patients. And physician involvement leads to physician accountability. Remember, the physician may view the problems of medical practice from a personal rather than an organizational perspective. And also remember, the administrator is primarily concerned with the maximum utilization of available health resources and personnel. Organization of medical resources may require a degree of control and surveillance over the doctor's work, which may be unattractive to him or her. In this slide you will see how the chief of the medical staff elected. The chief of medical staff is the elected representative of the medical staff. The chief of staff appoints all of the committees other than the executive committee whose members. Coming to the next slide. Functions of the medical staff. To advise the governing body on medical affairs. To accept accountability for the quality of care rendered to patients in the hospital. To request, review, and act upon reports of medical staff committees. To scrutinize the professional ethics of its members, and to initiate corrective action as indicated. To develop, implement, and review medical staff policies. There is more like to recommend action to the administrator on all medical administrative matters. To assure that the standards of the Canadian Council on Healthcare. Interrelationships among health workers. Remember, the complex tasks of highly skilled professionals demand a participatory decision-making structure, while the repetitive tasks performed by unskilled workers require a more formal hierarchical structure. Next and last slide is organizational structures. Highly structured and routine tasks can lead to worker alienation and boredom. Loosely knit, associational activities of highly skilled professionals results in personal gratification to the individual employee. Thank you for watching this video. To continue your lesson, please watch part 3. If you are getting benefited or want to give us any suggestion, then please comment and let us know. And please subscribe this channel for upcoming all videos. We are working hard for your pharmacy education. Our aim is to help students like you. Your support is our strength, so keep supporting us. Thank you.
Great, you completely watched part 2. To continue your lesson, please watch part 3. If you want to download this PPT file, then please go to our Facebook group. In our Facebook group you will get all our lecture notes from file section. Link is in the description box. For our next video update, please subscribe our channel and press the bell icon to get notification first. Thank you.